Hirlach agus dús caiimé rá ghfuilmuid buíochta hin féin an tairís seo a thuirt aig agus bémuid ag taú leis. We want to thank Sinn Féin for bringing this motion forward, which we will support. Ireland's health service is an underfunded shambles by design and really held together by the superhuman efforts of undervalued and underpaid health workers who are now pushed to their limit. Every aspect of healthcare is beset by large waiting lists, and the motion from Sinn Féin sets out the overall numbers very clearly. But we should remind ourselves that every single one of those numbers is somebody who needs care. People on the waiting lists are waiting for treatment that would be life-changing were they to receive it. Some people, such as the 649 children waiting for orthopaedic surgery that have been highlighted recently, are waiting so long that their conditions become inoperable, and often they are condemned to live a life unnecessarily blighted by illness and pain. The Spina Bifida Paediatric Advocacy Group have reported 56 children in Ireland waiting between 1 and 4 years for orthopaedic surgery to correct the condition that can cause paralysis of the legs, often accompanied by hydrocephalus or water on the brain. And we all heard recently of large waiting lists for the CAM service and how understaffing leads to inappropriate medication of children. Earlier today, some of our members attended the Patients Deserve Better campaign, and this was launched for additional neurological nurses to deal with what was described at their launch as a critical resource issue. The campaign set out why the government needs to recruit an additional 100 neurological nurses to bring the national number to the recommended 142 nurses needed. Apparently 800,000 people, a shocking high number in Ireland, are living with a neurological condition. That's people with multiple sclerosis, muscular dystrophy, epilepsy and other less serious conditions. The campaigners outlined today how there are close to 24,000 people on the public waiting list for neurological outpatient care. 8,600 of them have been waiting for over 18 months. Recruitment of the additional neurological nurses is required in reducing the current waiting lists. And according to the Neurological Nurses Alliance, Dublin alone needs 57 extra nurses. So, for example, St James's Hospital has 4 neurological nurses and it needs 14, a shortfall of 10. Tallaght Hospital has 3.5 nurses, it needs 20, a shortfall of 17. We fully support the Patients Deserve Better campaign and call on the government to urgently recruit the additional 100 neurological nurses that are needed. Neurological nurses play a crucial clinical role in providing advice, counselling and education support. And a speaker at the launch spoke of how one neurological nurse in her hospital is not available for public patients. Which brings me to one of our main points, and that is the question of public ownership of our healthcare system. I've read your speech, Minister, and not once did you use the 2 words sláintecare. It's like it's gone out of the currency into the history books. But one of the biggest problems facing our public health service is the existence, in a large way, of private practice in public hospitals, and also the very existence of many private hospitals and services. At every turn, public monies are being drained off by private interests, and this is central to the dysfunction and lack of resources facing the HSE and the public health system. We saw it very starkly during the height of the COVID crisis, where millions were paid out to take the private hospital capacity into public control, but as soon as we're out of the woods, it's handed right back to them, leaving us short of millions put into a private healthcare system. We have a very low hospital bed number per capita by international standards, and we have a very low ICU bed number by international standards. The lack of capacity in our public health system is one of the main reasons why we have such enormous waiting lists that are detailed in this motion. The Irish Hospital Consultants Association has called for 6,000 additional public hospital beds and 4,500 community step-down and rehab beds to alleviate pressure on the system. The Irish Nurses and Midwives Organisation recently said that the health service is rapidly returning to the bad old days of overcrowding in every aspect. and those that can afford it avail of private hospitals to access the care they need, while those dependent on the public service continue to join the waiting lists and wait ever longer. I'm reminded of the famous Joan Baez song, where the words written in the 60s about poor communities in the US, where if living were something that money could buy, the rich would live and the poor would die. In this situation, I think that often happens, but there's no doubt that poorer people definitely suffer. We believe it's time for private hospitals to be taken into public ownership to add to the capacity that we urgently need in the public health system. And if evidence is needed of a lack of commitment to even grappling with that problem, I think it is in the future of the National Children's Hospital and the proposed National Maternity Hospital. In the case of the National Children's Hospital, it has been built with over a dozen private suites, allowing for private medicine to flourish within that hospital. And in the case of the National Maternity Hospital, it has been built by ownership of a private company. And that's why I want to move the amendment People Before Profit have put, that we call on the Government to take all private hospital capacity and private organisations currently delivering healthcare and social care into public ownership as part of a single-tier national health service. This, coupled with the removal of private practice from public hospitals, would give us that single tier, entirely public, free at the point of need, at the core of a new national health service that we so badly need. I want to move that amendment agus deireadh a bhinstar táimid gléachar an rialtas gach ospidéal príobháideach a chomh faoin úinéireacht feibhlí. Gur maith agah.